joining us all the way from Qatar. Her name is Dr. Anisa Muhammad Ali, and she is a psychiatrist and has been serving humanity for a very long time, providing mental health support. And she has specialized in many areas, and she's also quite passionate about treating patients with a form of psychotic disorders. Let's welcome our guest for today. Assalamu alaikum, Sister Anisa.
Walaikum assalam wa rahmatullahi wa barakatuh.
Thank you so much for taking the time out for our viewers, for our channel.
Thank you very much for inviting me. I feel really honored and I'm very happy. To start with, I would like to start saying Alhamdulillahi Rabbil Alameen wa salatu wa salamu ala ashrafil anbiya wal mursaleen سيدنا ونبينا وعلى آله وصحبه أجمعين رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. Assalamu alaikum wa rahmatullahi wa barakatuh, and a very happy greetings to all of you.
Wa alaikum assalam wa rahmatullah. So sister, without wasting any more time, let's talk about psychosis. Tell us what psychotic disorders refer to. What is it like? What are the symptoms?
Well, to start with, in the mental health, something that we have found very difficult to explain and to break a barrier is psychosis. Every other diseases or every other health issues like depression or anxiety has reached the mass better, but there's always some kind of a barrier for psychosis. And when you think, what's the problem? What's the problem is because most of us, first of all, we have to know what is that comes to our mind first when we think of this word psychosis. It's mostly derived from our own experiences or experiences from family and friends. Or sometimes it could be mostly from what we get to know from films or what we see in the newspapers or social media. So quite often, right information about psychosis gets missed.
Right.
So basically, what is psychosis? Psychosis is just another mental health problem, like every other physical health problem.
Fair enough.
For example, diabetes, hypertension. So it's something very similar to that, psychosis. And what is psychosis? Obviously, we know psychosis is a problem that's starting with our mind or the brain. So what happens there is sometimes when we think, we start to think differently than many others. And that may not be the true reflection of the reality. The reality might be a bit disoriented, and that we call it as delusions. And sometimes what happens is people do tend to hear when there's nobody around, or see things when there's nothing there or no other person is able to see it.
Right.
And we call it as hallucinations. When such delusions and hallucinations start, there's other cognitive deficit, like, for example, problems with memory, problems with functioning in the life, in our social atmosphere, or with our work happens. And that deranges us. And that's the group of symptoms we call it as psychosis.
Right. So would you say it's something to do with losing contact with reality by seeing things that don't exist, hearing voices or sounds that others are unable to hear? Would you say that person starts to lose contact with reality?
That's correct. Yes, it's absolutely the right thing. He loses contact with the reality, not only by hallucinations, like abnormal experiences, but also because of thoughts that are very different than accepted as norm, culturally, religiously, or in human terms.
Right. What about tactile things? Like, do you feel sensations on your body that has no physical cause, or do you smell things or taste things that are not there?
That comes in abnormal sensations. For example, we have 5 senses. So Basically, the most stronger one is the auditory, which is the one that we hear.
Mm.
And then comes the visual, something that we see. And then
Yeah.
comes the smell, the taste, and the tactile. But you have to know the psychosis is quite varied. For example, if I had, for example, I had a patient, say he's working in a bakery, and he's coming and he's telling me, I think the MI5 is following me.
Mm.
And that, I think, I would say, well, it is a possibility, but do you have any evidence that the MI5 is following you? And then
Yeah.
he tells me, yes, I do have evidence because whenever I open my mobile phones after I speak to my friends, I tend to see the matters that I speak related is published all over. And then I said, well, that is something that many people are having it at this time, and
Yeah.
I would that is because of some kind of a AI, integrated in the phones. So once my
Yes.
friend told me, I told, if you really don't want that to happen, you got to put your phone on airplane mode, and so you don't have to fear it, or just keep your phone aside and then speak. And then I said,
Or
okay, disable
disable
it,
certain
absolutely.
settings. Yeah. Yeah.
Exactly. And then he tells me, well, Dr. Anisa, it's not just that, it's something else as well. And he elaborates, he says, there is somebody who can actually control my thoughts. Whenever I think inside, I see that it is published on the news. And that's what we call it thought form disorder. And he says the thoughts can be actually taken in. They can put in the thoughts and they can take it out.
Right.
And then you say, okay, that sounds a bit that it looks like your mind might play tricks. Would you agree on that? And he
Yeah.
says, maybe, because there have been other people who told me that minds do play tricks like this. But
Mm.
I'm so definite because I also hear the same voices.
Yeah.
The voice
Yeah.
that comes from me, they ask me to do things. So this kind of a thing is very much, you would say, of schizophrenia.
Right.
Whereas if somebody comes and tells me that they are seeing things more than they
Mm.
are hearing things, I would first see if they have any problem in their brain, because some problems that has like tumor in the brain, or hallucinations, will go for more of um, visual hallucinations,
Right.
not the auditory ones. So
Hmm.
in that way, you see the tactile ones. The tactile ones are very much common to do with cocaine, drugs.
Oh, okay. Yeah.
And I would ask them something to do with, are you involved in taking drugs, especially in a Western community? It's quite common.
Yes. Yeah. Yeah.
It
Even in
doesn't
the
happen very,
Muslim community, even in like Islamic countries, it's becoming unfortunately
very
quite common. Yeah.
yes. I have seen patients here with problems in drugs. So, and
Yeah.
that is not very much common in schizophrenia, but it can happen
Mm.
in other ways. Having said that, we are also developing new norms. What has been a few years ago may not be
Yeah.
the criteria for schizophrenia in another 10 or 20 years or 50 years ahead. We are also we are on an evolution. So certain things like a touch hallucination, or even people hearing things or seeing things, has happened to the normal population to a significant proportion. But until and unless it's not repetitive, it's not recurrent, and it does not affect your life, your work, your memory, your cognition, your thoughts, orientation, and your insight, it's absolutely fine. Because we are now
Tell us about the
bombarded with.
types.
Mhm.
Dr. Anisa, tell us about the types of psychotic disorders that exist or are quite common in, say, for example, our community. that the ones you come across on a regular basis when you see your patients?
Well, the first one is psychosis that cannot be categorized. You cannot just
Right.
pinpoint, but
Mm.
we would know that it might be going towards schizophrenia.
Okay.
The most common things in the mental health that I have seen across is depression and anxiety in Muslims.
Mhm. Okay.
And the next is psychosis, but it's going towards schizophrenia. And these are the early symptoms, which is good because they
Mhm.
have identified early on. And I have seen psychosis happening after postnatal. That is, after giving birth.
Fair enough.
The woman feels very stressed. They pass through the
Mm.
postnatal blues, and then they go into a phase of depression, and then the psychosis sets in.
Yeah.
And then I have seen people having psychosis because of acute stress.
Okay.
And it's very common. The psychosis, the peak range is sometimes between 15 years and 40 years. And I have come across adolescents starting psychosis at the age of 15, even though they have memorized a lot of parts of Quran, and when they recite Quran for 2 hours, they have no problem. But in other times, the psychosis sets in, they have complex hallucinations, and that has affected their school performance and their home functioning.
Right. Right. So one of the things that you highlighted is that if someone is using medications or drugs or, say, for example, alcohol or anything else that induces certain kinds of hallucinations or, delusions, that will not be classified as a psychotic episode. So how do you distinguish whether this is something which is being caused by, say, for example, psychosocial factors, or is it something that is genetic? I mean, how do you classify it?
Right. Okay. So basically, you're asking me what are the causes in other ways? How do you classify when psychosis comes in? When psychosis comes in, we make sure that is this psychosis something that's schizophrenia,
Yeah.
or what type of schizophrenia? Or sometimes psychosis can be due to drugs in Western
Mhm.
community as well as in Middle Eastern places. Or the psychosis could be due to following the depression. It could be because of bipolar. It could be because of the manic phase. And it could be because of other many reasons, like anything can cause psychosis. But having said
Right.
that, what is the causes? If you want to classify it for the causes, what causes
Yeah.
schizophrenia? The real
Mhm.
answer is we do not know. If I were to ask you, what causes cancer? You will say,
Yeah.
well, we really don't know what is the reason cancer happens to some and it does not happen to
Mhm.
some other.
Yeah. Yeah.
Could it be a natural selection? Is it the nature that
Mhm.
selects? In
Mhm.
other words, the degree. However, because we are from the scientific world, we do look into further things and we see that sometimes it has genetics, say like diabetes, a sugar
Yeah.
problem, or the BP problem, a heart attack. There is some kind of genes we have extrapolated. There is some genetic nature to it. So, which makes somebody very susceptible. If someone comes to me and asks, I have both my parents who are schizophrenic, what's the propensity, probability that I might have schizophrenia in future? I might say 50%, but not necessarily the person will have it.
Mhm.
So that's genetic. And then
So,
we also go on.
yeah, no, please
I
continue.
Yes, in and it is very common that they have also identified while the child is being with the mom, if the mother had any infection, especially H influenza or any other infection, then that might be the cause for later on for schizophrenia to happen. And it is also hypothesis that people who are from the minority, who are less privileged, and sometimes even winter birth do give rise, all those low, dull mood where it's not
Mm.
cheerful and give rise to schizophrenia. Stress can give rise to schizophrenia. In the Muslim communities, I have also seen that the social format of the family, if the family has a lot of conflicts and there's not enough support for the children, and in the families where there is what we call as expressed emotion, where there is high expressed emotions, the rise of schizophrenia has been quite high. And this is exclusively in the Muslim families.
Right, right. One of the things that we're going to talk about today is schizophrenia. Although there are so many different types, if you could briefly highlight them, and then we could kind of get an understanding of schizophrenia is.
Okay, so within the schizophrenia, I can tell you what so far we have been discussing is positive symptoms.
Right.
That is, in the brain, if you ask me to spot where exactly the problem is, I will tell you in a temporal lobe, and especially in the hippocampus, the center that is very important for learning and memory.
Mm.
So what happens is there is a dopamine surge, and then you find the problem happens. The hallucination, the delusions do come from the temporal lobe.
Right.
And when the temporal lobe, until then, when you start to identify, and this is the most common form of schizophrenia, and
Okay.
when it is early identified and we give medication, it's kind of, there is a good remission rate of 60 to 80%. That is good response to the medication of 60 to 80%. The patients have less symptoms. But there
Right.
is another form as it develops because of the compensatory. For example, if I'm going to an exam, and where do you think my blood flow will be? My blood flow will be to the brain. And
Yes.
so I would think, oh, I don't want food. Many students, when they're going to exams, they're so nervous. I'm very exam nervous. I don't want food. Mommy, don't disturb me. I don't want anything. I can't just take up anything now. And that's a very natural thing because your brain, all the blood is going to your brain, and the neurons are firing, and you don't feel hungry.
Mm.
Okay. Similar way, in the time of, when you have a nice food in the afternoon, really good food, you see the blood is redirected to your stomach, and it is less to your brain. So you start to feel a bit drowsy and you feel like you want to have a nap. And that's a very common thing. So as a compensatory, what happens in schizophrenia within the brain is, as the temporal lobe gets affected, to
Mm.
kind of compensate sometimes, in the frontal lobe, certain chemicals like serotonin start to play up. It's called as hypofrontality. Some of the chemicals go down. And then the person starts to have symptoms very much that mimics depression, very being aloof, having a very kind of a face which is very incongruent, showing incongruent emotion and some kind of a physical retardation, So that kind of a schizophrenia is called as epiphrenic schizophrenia
Okay.
or disorganized schizophrenia, which is very difficult to treat.
Really.
Yes, and that would be the time when you ask them to do a MRI scan or a higher MRI scans, then we could find quite a lot of structural changes in the brain.
Mm. Right.
And sometimes when you go, there are other forms of schizophrenia as well, like simple, and some are unclassified that you cannot put in anything because for schizophrenia to classify them, we have to tell they should have at least 1 month, 4 weeks
Right.
continuously. They have to have the symptoms, and sometimes they do say that there should be at least 6 months. They should have had some kind of, they call it as atmosphere, delusional atmosphere. You kind of feel delusional. You feel like something is not going right. But
Mm.
some of symptoms, if I were to tell you, you will think, oh my God, that's actually developing even in our population. Like, for example, perceptional, misinterpretation. That is, people from schizophrenia, when they go on the road and say the traffic signal turns from green to red and they have to stop,
Yeah.
they will think, if it goes to red, it means, something bad is going to happen in my family.
Right. Wow.
Or if something else happens, you go on a street and you find top stocks going on, and some of the stocks are red going down and some of the stocks going high, and you think, oh, and you find a lot of numbers and you think, oh, these numbers are actually related to me or my life in some way, and this is what it
Mm.
implies. And
So
you
your
just look
perception deteriorates. The way you perceive things around you, the way you perceive the world, that's totally
how you
affected.
understand
Okay.
it. So you look at something, but you kind of derive a different
Meaning.
meaning to it.
Right. So if the neighbor's
And
dog is barking, you would think that this dog is barking at me because the dog hates me. It's like,
exactly, it could be, yes. Or even worse, they could think, oh, it has been organized, there's some other bigger force, like, which is trying to get the dog against me, or everybody is going against
wow,
me.
wow.
But you could as an experienced psychiatrist, you would be able to look at the patient and say, what is the
Yes.
cause, whether
Mm.
it is a drug, or whether it's depression, or it's bipolar, or it's schizophrenia, or it's other form of psychosis. Anything can produce psychosis. Like I told you, alcohol, tumors, anything, metabolic disorders, anything can cause psychosis. So, you will be able to find what is the cause and then you treat the cause. However, for most psychosis, which is not having an organic cause, the first line of
Mm.
treatment is antipsychotic medication.
So is medication the only way to treat a psychotic disorder, or can you use a combination of psychotherapies as well?
It depends. The first
Okay.
line
Mm.
of any treatment for psychosis is medication, because
Okay.
most often people
Hmm.
with psychosis or schizophrenia, in other words, might have no insight.
Okay.
They will not. If I were to tell you, I do acknowledge what you're telling me, but do you think the mind could be playing tricks? Some people might say, yes, the mind could play tricks, but it's all real for me. That's true,
Yeah.
because they are seeing, they are hearing, and what they are believing, a lot of the thoughts, is very real for them. But it's just that we are not
Mm.
able to see our world.
Yes.
So it's very real. So for that symptom to come down, and so that they can start discussing something, we need to first give them medication. However, the CBT, and there's something called as other, a cognitive rehabilitation. We call it
Hmm.
as a recovery pathway, because many people do struggle a lot if they do not keep up with the medication, and do have problems in the later life. So
Hmm.
cognitivity and cognitive restructuring, cognitive mediations are highly, highly, highly helpful alongside the medications. In other
Right.
words, even in Islam, Allah says the pen has been lifted, that is the accountability, has been lifted from three people: the one who's
Yes.
sleeping, the one who's a child, and the other one is someone who's not mentally sane.
Mm.
So if someone
Yes.
do not have that kind of a thing, to an extent that they, even if they pray, their
Yeah.
prayer may not be validated, kind of. So
Yes.
if they are in that kind of a state, then medication is always the first line. We have tried we have tried CBT and other forms. It kind of works well, but I still believe that medication could do well. And of course, I do not know if you wanted to bring this up later, because in our Muslim community, we have different beliefs about
Oh
psychosis as
yes.
well.
I was actually, that was one of the things that I wanted you to kind of elaborate on, because um, with medications, there is this myth that lots of people think that, oh, this is going to be for life. We have to take medications for life. There are going to be so
Mhm,
many side effects. So let's just avoid that. And then they go to
mhm,
healers and faith, spiritual healers, and they associate it with being possessed by a
mhm,
jinn or evil spirit or al-ain, things like
mhm,
that. And then instead of going through the right channel, instead of approaching a mental health practitioner to get it
mhm,
sorted, they kind
mhm.
of make the symptoms from bad to worse. So, how do you
Absolutely.
deal with that? I'm sure you come across people who are kind of in a state of denial that no, we don't need medications, we don't need help.
Absolutely. You're 100%, not wrong. Um, Actually, you would be surprised. I'm going to tell you something. Can psychosis be caused by external factors?
Person.
Okay. So there are internal and there are external causes.
Mhm.
And can psychosis be caused by the external causes? The answer is yes. It can be caused by the external factors. Can the jinns or the shayateens able to
Mhm.
cause psychosis? Yes, there is a possibility that they can cause it. But what I have seen is it's not that if the shayateen is there are 10 Muslims, and if the shayateen wants to cause schizophrenia in all the 10 Muslims, I do not think that it can cause schizophrenia in all the 10 Muslims, because there is some sort of a vulnerability in certain people
Mhm.
that can make them get schizophrenia, whereas the others may not.
Hmm.
And for a long time, to be honest, I used to think the high protective factor would be Quran, which
Yes.
I still believe, which I still believe. But in my recent times, I had been quite surprised myself to find children, adolescents, or even young men who have learned a lot of Quran, memorized it, and they recite Quran a lot, but they do have psychosis.
Yeah. Yeah.
I have seen other things like depression and uh, chronic fatigue syndrome from women and men who have done hafid of Quran and who are teaching as well, who are quite patient, who have very good personalities, because everything does do matter, every single thing matters. So it is something that has taken into surprise even for myself, to start with. But however, uh, the thing is, yes, it can happen. It is okay for Muslims to go to Iraqi or to for Ruqayya. It's okay.
If you could
But
please
the problem,
tell our viewers what that is, if you don't mind, just briefly what that is, in case people don't know.
what is
As in, what is Raqi and who is a Raqi and what is Ruqya?
okay, Ruqayya, the person from the religious side who would recite Quran, and who would be able to if somebody thinks that it is because of the jinns, or if it is because of some kind of a possession, they could go and he will recite, or maybe he would give some water, recited water or oil to apply. As far as it is a recited material, a cream, oil, or water, or it is just recitation upon them, it is allowed, it is okay, and it has no problem. But if it is anything else, which is first of all not Islamic, they have to know, if they are going to just go into shades of kufr and shirk, then they have to know that's not going to help, it will make conditions worse.
Yes.
From the medical side, it is like sometimes it's not about what you get, how you get it. If I'm going and I'm just falling off my bike, I have to take, and I'm injured, I have to take medication. It does not matter
Of
how I
course.
got injured.
Hmm.
And I myself personally, there have been times where I think there was some insect bites and I just do Surah Al Fatiha and it goes off. And sometimes I think, oh, this one, I think I need cetirizine. Once I remember, somebody had seen, this happens to many people, just not me. They come, they see, and they go, and then your face becomes spotted, or something happens to your health, and then you go to the doctor prescribes you something. They say, oh, maybe some kind of atopic dermatitis, allergic dermatitis, or something, or maybe it is just let's have the medication. So sometimes it's not about how it is caused and who causes it and where it comes from. The
Yeah.
treatment is medication, because it could have been caused by anything, but the treatment is medication. And when you come and tell me, long time medication, this is what I'm saying. People, when it comes to mental health, they have a different perspective than the physical health. If it is for diabetes, they're happy to take medication throughout. If it is for hypertension, they're happy to take the medication throughout. They don't go
Yes.
and ask, doctor, can I stop it after a while? The doctor will say your hypertension will come. In fact, if you're going aging, it's going to be worse. It can get worse because
Yeah.
you might have more of cardiac risk. And you cannot come out of certain medications. And the
Yes.
same for heart attack or stroke. Sometimes certain things, even not stroke, but even TIAs or things like, there are many conditions, health conditions in this world where we need to take medications regularly.
Yes. Definitely. Definitely. Yeah.
So it is the same, and it's the same in schizophrenia. There is a problem in the temporal lobe we have identified, and I think the problem is more often to do with the connections of hippocampus throughout its surrounding areas, and that affects the other lobes as well. And there could be, other theories. So we are looking to control the symptoms.
Mm.
Basically, it is like diabetes, because in diabetes, we are actually trying to get the sugar level down. We are not going into the
Yes.
glands as such,
Some people even
we're
have to
just
take insulin. Yeah.
absolutely.
Absolutely.
And oh, it's echoing.
Don't worry, it's fine.
All right. So, it is like diabetes. So you have to take. But actually, the good thing about psychosis is more often once it has a good response, then as we go older and older, it is actually many of the mental health illness do regress a bit.
Mm.
It doesn't get worse. It kind of regress a bit, and you can always maintain them on a low level than what they have been started. There are other ways to provide, like CBT.
Yes.
In Routine Minds, we have been looking into various methods. The more patients we come across, maybe we will be able to kind of do a little bit more active, looking at research into it. But we have tried a few methodologies, if that could help, and it kind of helps. But I think to start with, maybe a good medication, and then to go with the CBT, and then there are other things called social skills training to see where is the deficit happening. When you have psychosis or when you have schizophrenia, which parts of your life is getting
Mhm.
affected? If it is at home, sometimes, in the home, what is it that getting affected? Is it your relationship getting affected? Or is it your everyday functioning getting affected? Most often, you find the one common thing that gets affected for is the normality of life. The
Right.
regular schedule. Like you get up in the morning, you do some things, you
Mm.
go out, you do things, and then you take rest in the evening. You be with your family, you take rest in the evening. This is kind of a norm. This norm can be
Yes.
broken safely and could be having a breach safely. But if that is going to be too much of a breach, you find more often in mental health patients. That's where the problem is, that they will not be able to sustain a normality, because our chemicals in the body, there's a different chemical in the morning that gets secreted, there's a different chemical in the afternoon, there's a different chemical in the evening, and it is good to have that, a kind of a normal schedule. And
Yes.
sometimes
Yes.
I have seen in my practice, when we are able to inculcate just the normal schedule, getting up in the morning, do this, do this. I know it needs a lot of help, but when there is a family with who we have given a bit of a psychoeducation to the family, and help them to, like, as a carers, to take care of
Mm,
themselves, as well as how to actually have a nourishing, care, as whether it is a spouse or whether it is a child, and it has kind of helped while they maintain a good normal day. That helps in the remission, in getting better, much better.
right,
So it's like those
right.
subtle things, and then what we call as social skills. At what time of their thing? So, do they need help with the exams? Is it the
Mm,
subject that is affected, or do they help having problems with attention? So, is it some that kind of area that we could cover? Are they having problems with social interactions because sometimes they're very comfortable with their family but not outside?
mhm.
So
Yeah,
things like this, what area, or some kind of a vocational skills, and also depends. We say about nature and severity. What is the nature, and then what is the severity? We assess it, and
right.
accordingly, we start the medications and we give other help as well, and we treat them as a
Mm.
a person is whole.
I think what we need to understand as community is just like in the human body, if there is an imbalance in the blood sugar or cholesterol or any other chemical that is required for our body to function normally, we don't feel ashamed or fearful or embarrassed to go to our GP or doctor to seek advice. Similarly, people experiencing mental health difficulty or psychological disorder should not feel embarrassed, ashamed, guilty, or fearful in approaching a mental health professional to seek advice or medications. And that's something we really need to kind of work on and spread that kind of awareness in our community so that we can encourage people to come forward, talk about their problems, and get the right advice from the right kind of people.
Absolutely.
Would you like to share some examples from your professional life that would help us in understanding what schizophrenia is like? What is it like to be a schizophrenic, whether it's catatonic or any other form?
Right. I could tell you a few examples, like, this person from the bakery who had come in, and, the problem is when they come in, it gets very difficult for them. And at one point, they even start thinking that maybe the doctors are also working for MI5. And then we give the medications, it gets better. They go home, and then they could come back again because they're not taking medications, or it can get, the symptoms come after a while. And this is just one group. Say, for
Mm.
example, because I think you're kind of interested in how we also identify. So we had
Yes.
another patient. So I will just discuss a few patients. We had another patient, say a 17-year-old boy, who came and said, "Doctor, I seem to be having some hallucinations. I can start hearing things. And in fact, like you said, when I'm closing my car, I feel there's something that is touching me, or sometimes when I
Mm.
pull the, I'm trying to, there's something that is kind of touching me." And I told him, okay, does that symptom there all the time? He said the touching symptom is there all the time, but the hearing voices comes and goes. I said, when is the time it comes and when is the time it goes? And he said there's actually no relationship. And when I started to ask about the other symptoms, like, do you think that your thoughts could be stolen by someone? He said, no. Do you think that as you speak something, it is being broadcast on the news? And he said, no, we don't have such thoughts at all. And then I asked him, okay, in that case, do you see things? And he said, no, not very often, but there have been times I have seen shadows.
Right.
And then I asked, okay, so what is your everyday like? Just describe your day. And then obviously, these people, they say, oh, I actually, when I'm in the university, I kind of do very well. But now in the holiday, I have come home, and that's the time I happen to see him. And I do not know, it just feels like it's getting worse. And then I told, tell me the
Mm.
truth. So, do you take any drugs? I'm talking about Muslim families. And he
Yeah, yeah,
said,
of
yes.
course.
And he said, yes. What do you take? Cannabis. So where do you get it
Mm,
from? I said, I have a group. And he has come for a holiday, and he is studying in another place which is also a Muslim country, and he has got used to cannabis from there as well. So whenever he goes there,
mm,
he does cannabis, and whenever he comes to the holidays, he has a group of friends. We would take cannabis. So I said, is it something that's normal? And he said, yes. In fact, there are other places in the Muslim world where it is very easy. And then he would actually talk a lot about Islam, and he will talk a lot about, being strong in Islam, and, able to do jihad and things like this. So, and then I felt something that is very important in our Muslim community is not just that particular person, but many people, whoever I have seen that the religion is being used as a symptom of telling their symptoms. When I
mm.
see in UK, when I work, and when I see the British population, they do come and say, "Oh, the MI5 is after me." That's a very common thing. Or my brother is after me. You know, or sometimes, they think, if when they go to manic psychosis, they will say, "Oh, I can fly. I think I'm Jesus. I think I can
Yes,
heal and
heard that one.
cure, and I can jump over the bridge and I would be able to fly," and things like this. Because sometimes it is our thoughts, our beliefs that get transformed into altered reality. And in many times, I found that when Muslims do come, especially people who know Quran and some religious knowledge, they actually, when they tell you, you will see that when they talk about religion, many people, it is something the West have to know, because when the West listens to these kind of narrative, they get scared. They think, like, oh my
Yeah,
God, something wrong with this group. Why do they speak like this? But the West have to know this is a way of actually expressing their symptoms.
yeah, yeah.
For
Because I think
example,
a lot of people. Yeah,
if
go
you,
on.
for example, if you have OCD, when you do the wudu,
Yes.
if you go and ask a person who's got OCD, they will be so much times doing wudu,
Mm,
and they will take so much time. And that's the reason Allah says, don't worry about it. When you have a doubt, just complete it and come out. But
yes.
they won't be
That's
able
the
to.
beauty of a religion.
Yes, they won't be able to. And they, when you ask them, what is it, you sound very religious. You're getting me so many, hadiths and Quran. Can you tell me, uh, have there Allah not told you this hadith? Is it not being possible to just leave that and come? This is just to challenge their thoughts, because we do know it is not easy and it's not something they
Yeah.
could do. But when we say to them, they said, no, 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 I want to make sure, they bring in other values, like if you do not, wash a place and this and that, the prayer is not accepted, or, other hadiths. And you can see that is more of, they want to bring in things so that they feel better. They have a cognitive dissonance. They think like there's
Mm,
something wrong, but how do you also make yourself feel better about what you're doing? So where do you find that safety network? Where can I go and have the secure feeling? And sometimes even in psychosis, people are not accepting. My family is seeing me differently, and they're very shy to even say about it. It's not like I'm
yeah, of
having
course.
diabetes and they say I have schizophrenia. So where do I
Mm,
find my um, you know kind of a secure place, my escape? And then they try to get it through Islam, but sometimes it works out when they're doing it properly. But sometimes it's more of they having narratives that will make somebody feel like that's not actually right. But as psychiatrists, we know that, okay, that is a part of the way they present as symptoms. So that's something very, very interesting that I have found with communicating. And then, if you want one more example, I had a lady who had a very, very good pregnancy, but after the delivery, she started to have postnatal blues, a lot of crying, and then she started to be very, very, very depressed to a level that every time she started to think about, she wants to be dying. That's actually depression, but it was almost going to things like starting to think about, maybe, uh, some things may not be right with me, maybe some people are trying to plot against me, or so sometimes what happens in postnatal period is it might go into psychosis, and then
Right.
it can to an extent that they will start thinking that, okay, it's not just about plotting. Now they will start to listen, hear to voices, and they will even start to harm their babies. But most
Wow.
often in Muslim communities, it could still happen, but it's not as much as of a worry that I have seen when compared to the Western world. But it is not something you could exclude on. Uh,
Hmm.
Actually, in my minds, I have treated patients with um, actually moderate depression to severe depression without medication. Like you said, they want to say, oh, I will first try with non-medication, and then if it doesn't work, then I'm happy to take medication. So
Right.
cognitive behavioral therapy and some of the therapies that I do as a part of Reviving Minds has helped them out. A lot of people, even drug induced psychosis, we've been able to help until and unless they keep away from the drug. But then
Right.
if they cannot keep up with the drug, away from the drug, then it is very difficult. In that case, they do need antipsychotics, at least to keep in check that there is no problem arises, and the children complete their university and they have to get into the some kind of a jobs, because they don't have a self uh, control, or they when there is a group of friends who want to go and do something, they want to be a part of it.
Hmm.
They don't want to be feeling socially isolated.
Of course.
So
Is psychosis something that is prevalent amongst adults only, or is it something that is also found in children? And also, is it something prevalent in men, or is it something which exists both in men and women?
okay, the overall incidence in the world, it's told to be about 1.5 in every thousand, maybe.
Okay.
It's not that much, but actually, in reality, I do find that this kind of varies a lot between region to region. If you go into the
Okay.
Asian communities and Middle Eastern communities, you might find a bit of a male preponderance. There is a little bit
Okay.
more happening in the male, whereas in the Western world, you find it is equal. And
Hmm.
any time from age 15 in an Islam Muslim population, I have seen as young as 15-year-old boys, and quite a
Okay.
lot of I'm 15-year with no family history of uh, any psychosis, no problem, or no problem in the birth, no problem of anything. The only thing sometimes you can find is high emotion and kind of a dysfunctional families, that have kind of precipitated psychosis. And then we do find a
Hmm.
quite a big size group of adolescents who are taking drugs and who have got psychosis. So there is a small variant that starts at 15 years with proper
Hmm.
psychosis schizophrenia and with other features. And then you have another one, a group, lot of drug and alcohol. And then you go to the adult, there is acute stress, or, that can cause problems. And then you have the women, especially in the women, it's the antenatal, postnatal period. And there are some women who do have some kind of psychosis, even if you cannot characterize it into schizophrenia. But schizophrenia tends to not happen as much after the age of 40, 45. The maximum is
Really?
54. Yes.
What
So
was
even
that?
some
Any specific reason?
that has been a really a surprise, because that's the reason I said many conditions are very much like for ADHD. Many people tend to grow out of
Mm.
ADHD because of
Yes.
the variety different kind of the hormones, and the perhaps the treatment, the different kind of hormones, or maybe the structuring of the brain, the connectivity kind of matures in a way that it matures out of schizophrenia. But then what happens in your later life is more of degeneration. Like the adults start to have bone degeneration, they start to have osteoporosis, something like that. The brain also starts to get degenerated. So more often what happens is memory problems, like dementia. In the old
Mm.
age, you would dementia takes more preponderance, more kind of a possibilities than schizophrenia or psychosis to start at that time. And psychosis is very prevalent only from 15 to 25 or 35. The maximum you can go is 40, but if you have to stretch a lot, it is 50.
Yeah. Okay, that's interesting to know. Thank you. Dr. Lisa, we only have 2 minutes left before we
Sure.
can finish this show. If you could give us a final message to all our viewers who are watching right now.
Mental health issue is so important as physical health issue. We take time, especially women, or we take time to go to look after our beauty, like to the parlors, to for the haircut, for the saloons. And there are women who don't do that as well, but you have to take time for yourself. And if you're having stress, any kind of stress, please speak to a mental health professional. Sometimes we think we suffer in silence, and even men always try to postpone. They think, oh, it may not be that, at the time of peak things, something happening, they will think about it, then they just leave it. So
Mm.
we spend a lot for everything, like time or money or our efforts. So whenever you feel stressed, when you think something is not right with your body, mentally,
Yeah.
physically, or something impacts on your mental health, something is not right about your children, speak to a mental health professional immediately. They will tell you what it is, and they will give you the right help, even if it is a counseling. Because we do get children who have got low concentration and low attention, and then we look if it is ADHD. Some of the children are not ADHD, but they just have
Yeah.
problems with low concentration. And then we say, oh, this kind of a counseling or this type of therapy is enough.
Fair enough.
And it's the same for the adults as well. So anything at all, early identification is so
Mhm.
important to have a good outcome. Someone who is early identified and started the treatment or a therapy will have a good outcome on a long term, rather than someone who
Right.
has suffered a lot and come after a lot of suffering and then finally reached a mental
Mm.
health professional. So doctors are there, and the mental health other professionals are there, and make it as your first point of contact. And your GPs are there. Just go and tell them, they will be able to identify.
Thank you so much, Dr. Nisaf, for that insightful discussion on psychosis and schizophrenia. If any of our viewers have any questions, comments, feedback to share with us or with Dr. Anisa, please feel free to contact us on our YouTube, Facebook, Live TV page. Look after your mental health. We'll see you again next time with another episode of Aagahi next Saturday. Inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh.